Hi, it's Dr. Bob Graykowski, creator of the Better Brain Blueprint. So this week's topic is a very common problem with our nervous system called anxiety. So anxiety is actually something that is created, it's like a memory pattern that certain things will trigger it, certain place that you're at, certain words that you hear, certain sounds, certain visual things. It can be a lot of different triggers. So anxiety is actually triggered by a little tiny part of our brain called the amygdala, deep inside. It's called the part of the limbic system. That is our emotional memory centers. So what happens is sometime in your life you could actually have something that triggers this emotional stress response. So you get into a fight or flight. You see the amygdala is the gatekeeper for your stress response. So it sees something as threatening. And this threatening response triggers off the anxiety fight or flight response. So your breathing becomes more shallow, your heart rate becomes increased, your circulation to the vital organs is restricted, and it pumps blood to the extremities to fight off a situation. The challenge is, a lot of times these are like on a feedback loop. So you just keep having these anxiety attacks or anxiety responses many years over and over, and you become actually hardwired to this anxiety response. So what we need to do is look at what the trigger is and start to calm down that response. There are two main ways that you can actually reduce an anxiety response. One is actually just being more conscious and focusing on your breath. That kicks your nervous system into called the parasympathetic, which is your lowered state, kicks you out of that fight or flight response. Just breathing diaphragmatically. But on a long-term, regular basis, meditation is probably the best thing to do. I just finished up my morning meditation here up at Silverheart, and it's amazing how much more calm and relaxed you feel. Meditation is putting quiet time so that all those files that are open in our brain, all the things we think about on a subconscious level, can actually be closed so that we can get down to what is most important to us in our daily life. Anxiety affects 40 million people, and most of the time people are medicating themselves. So my recommendation is to really see what is triggering that response. Either get some help where you can talk to someone to calm down that response as opposed to taking medications. Start to put meditation into your daily life as one of the main priorities. And then if you get an anxiety response, make sure that you're breathing from the diaphragm to kick you out of that immediate fight or flight. So this is another Better Brain tip of the week. Until next time, it's Dr. Bob signing out.